So hundreds of private pharmacies will allow walk-ins for unregistered persons over the age of 35. Martin Kingston is with Business for South Africa and he joins us now. Mr. Kingston, thank you so much for making time. When are these private pharmacies going to start vaccinating these unregistered adults?
Well, they're available immediately, Clement, I have to say. We've made it clear. We put out notification in the course of the last 2 days that anybody can turn up, whether they're insured or uninsured, scheduled or unscheduled. Indeed, they can even in many of these pharmacies register and get vaccinated at the same time. There's some 810 pharmacies already across the country that are ready and available to vaccinate, and many of them have already been, of course, in the program. But as the Premier was saying, we need to significantly increase the level of vaccinations, particularly but not only for those over the age of 60 and 50, and that will hopefully be boosted, as the Premier also indicated, by allowing those over the age of 18 to come into the system as soon as practically possible.
Yeah, so people can just go into these private centres? Must they have a medical aid? No. What information do they need to provide as they approach them?
They need to have proof of their identity. Ideally, if and to the extent that they have registered already, that would be advantageous. To the extent that they've been scheduled on EVDS, they can reschedule on EVDS as well. We have historically looked at streaming people, so those that are insured going to the private sector sites, those that are uninsured going to the public sector sites. But increasingly we're seeing that there's crossover between the two. We recognise that convenience and accessibility is absolutely central. So anybody who is eligible, so they should have registered on EVDS, that's very simple as we all now know to do, can go into any pharmacy that's on a list of pharmacies. It's accessible on our website. It's accessible now on the National Department of Health website, and get vaccinated. If they're covered by medical aid, then the pharmacy will want their details so that the pharmacy can recover the cost from medical aid. Alternatively, if they're not, the pharmacy will recover the cost from the National Department of Health.
Yeah, and I suppose this is going to help, especially when we start seeing the 18-plus cohort being allowed to vaccinate. I know our government is considering bringing their vaccination date closer because the vaccination rollout has really been slow of late. So the issue is not so much the availability of vaccines, but it's getting people to vaccinate.
Yeah, Clement, you're absolutely right. Historically, and in fact, until a couple of weeks ago, one of the constraints indeed was access to the vaccines. We've got a stock of over 10 million vaccines now and a very clear and visible and predictable pipeline, both of J&J and Pfizer, until effectively the end of the year. We've got a number of sites already in situ, plenty of vaccination capacity. The issue is getting the people to go to those sites to be vaccinated. We've now launched a program within the National Department of Health and with Business for South Africa and our social partners to look at how we can increase demand. But we certainly hope that those who are over 18 and above will be able to assist those who are elderly, let's say over the age of 60, who may have had difficulty accessing the vaccine, to go along and get vaccinated as well, because we need absolutely, as you've said, to boost the level and the speed with which we are vaccinating the population, the adult population at large across the country.
Martin Kingston, thank you for making time. Chairperson for the Business for South Africa.